network, because the network is what got me where I needed to be, right? You often hear a lot of times people come out of school and, they're struggling to find a job. And we live in a time now, it's more than just putting in an application. It's really about networking and who you know. I've gotten all my jobs because of who I know, or just putting myself out there. Majority of my jobs, I wouldn't say all of them, but I just took the time in my MPH program because I saw what happened in undergrad. When I came out, it took me 2 years before I went back out and got my degree. So around that time, we were still in that recession, or coming out of the recession, and it was very, very hard as coming out with my undergrad, not being able to find a job, especially with a degree in sociology. So I remembered all of the valuable advice that I got, and I made sure and I networked. And networking gave me the opportunity to intern, and the internship turned into a job.
This is the Public Health Millennial Career Stories podcast, where you'll hear about diverse career stories, career strategies, get tips, and learn from others to help you in your public health career journey. If you want to learn about public health careers, or just hear public health stories, stay tuned because you won't want to miss this. Welcome to the Public Health Millennial Career Stories podcast, episode number 89. Hi everyone, Omari Richards here. Thank you all so much for joining me. It's been a while since I interviewed someone, but I'm glad to be back on this route of interviewing people and telling more stories. Be sure to follow me on Instagram at the PH Millennial. Be sure to subscribe if you have not subscribed to this podcast as yet. Be sure to leave a review, leave a like, share with a friend. Greatly appreciate you, and that helps support the show immensely. So definitely do that. Appreciate it. If you want to support more than that, you can go to thephmillennial.com/support and find ways to support on there. Really enjoyed today's episode. It was a breath of fresh air to just get back talking to people and just hear stories on the podcast. And I'm glad that I get to share more of these stories. I think an important thing to highlight from here is just networking. I connected to this person through LinkedIn. I'm not LinkedIn, through Instagram, and networked from there. She networked to get her jobs. And I just think that that's an important key that you all should be doing, especially now, as a lot of people looking for jobs and looking for new things, new opportunities like that. But I will stop speaking. Enjoy the episode. Have you been wondering where you can get some public health attire, some public health swag? Yes. Well, the Public Health Store is here for all your public health apparel needs. They are uplifting, inspiring, and bringing awareness to public health through cool apparel. So be sure to check them out at thepublichealthstore.com and use the code ThePHMillennial for 10% off. Back to the episode. Today, we have a results-driven public health professional with 9 years of experience in presenting, coordinating organizational or community health promotion programs. Her goal is to inspire and help people live a healthy, meaningful life through health education programs focused on mental health, stress management, and self-care to ensure that they live their best lives. She got her bachelor's degree in sociology at Montclair State University. Later, she went on to get her master's of public health at Montclair State University. She currently works as a program coordinator at Rutgers University Center for Public Health Workforce Development. Check her out on Instagram at health&wellness_guru. We have Kendra Julien, MPH, MHFA, CCWS. Welcome to the show.
Thank you, Amari. Thank you so much for having me.
It is my pleasure. It's always nice to have some Trini blood on the show. So I'm glad to get you on to tell your public health story.
Thank you. Thank you so much.
My pleasure. So how are you doing, and how you been coping during this wild thing that we have called the pandemic?
I've been doing well, actually. I mean, I've been adjusted after the last 2 years, of us being in this pandemic. I found a way to see, what works, what worked best for me in the beginning. I'm sure many could say the same. It was very difficult, it was challenging. I mean, we learned about the pandemic in our while getting our masters or getting our bachelors, but to actually live it was something else. But I'm doing pretty well. As far as coping, I found ways to get through my everyday life, whether that's managing stress on my own or finding ways to take care of myself and my mental health. That has helped me tremendously throughout these 2 years. And it's something that I, continue to add to my daily life. It's not just because the pandemic is here, we feel like it's ending, which it's still around. I'm going to stop. It's something that actually helps me get through every day and to cope well and to be about my best, right? And to perform well in my work.
Yeah, I absolutely understand that. And I feel like that, as you said, like a lot of people have dug in and understand the importance of just knowing what's good for you and how to incorporate all that into this pandemic life. And I think a lot of us have learned how to deal with that self-care, quote unquote, that people have talked about, and just adjusting to what this new normal brings. So thank you for sharing that.
Absolutely.
Yeah. So how do you identify, and then tell us a little bit about your personal background?
Yes, I identify as she, her. And a little bit about me. I have, as you mentioned, I have my master's in public health, and I've been in the field for about 9 years. I have done different types of work, whether it's at my job or outside of work. I have started off as a health educator and also program coordinator, so implementing programs. My first job opportunity was at the Partnership for Maternal Child Health, a really amazing opportunity that paved the way for me to be who I am as a public health professional. And I've done work in environmental health, vaccine preventable diseases, adolescents, focusing on HPV. And currently now I'm working at Rutgers University. I'll talk a little bit more about that as we get into the interview, but I'm a program coordinator, and I put on educational trainings for public health, governmental public health employees. So I absolutely love what I do, and I'm super grateful to be in the field of public health, because when I first started 9 years ago, just like many people would ask, well, what is public health? I was still trying to figure out, and I feel like I found my calling.
Well, I'm glad to hear that. And it definitely sounds like you had an array of different positions and different learning opportunities that you had in public health. And as we know, it just spans so many different topic areas. And it seems like you were able to dive into that, even though not knowing what public health was, which is the case for most of us. Even going into your career, you might still not completely understand what public health is. So I appreciate that. And you're from New Jersey, right? Or you grew up in New Jersey?
Yes. So born and raised in Newark, New Jersey. I currently reside in Elizabeth right now. And as you mentioned earlier, my parents are from Trinidad and Tobago.
Okay, shout out to the Trini parents.
Yeah.
So before we get into your story, what does public health mean to you?
So for me, when I think of public health, right, we know public health is a very, very broad field, right? I see public health in everything. And for me, one thing that stands out for me, especially with all that's happening now, what we've been seeing for the last couple of years, as far as people's health, I think what's important for me and what it means to me is health equity. I think everyone deserves equal access to health care. And most importantly, everyone has the right to live a healthy lifestyle. It doesn't matter your socioeconomic status, your background, your race. In order for us to function and to go on about our daily lives, we have to be healthy, right? We have, that is what keeps us going. And that is the number one thing for me as far as what public health means to me. And awareness, right? As a health educator, increasing awareness is something important, right? Like educating people about the importance of living a healthy life, right? We can go deep into this, everybody comes from a different background and a different walk of life, right? So what may be a priority to you or to me, as far as public health professionals, may not be a priority to someone else. So awareness is definitely key. And health equity is something that, been on, my heart or something close or they're close to me for the last couple of years, so.
Okay, well, I appreciate you sharing that. And I always like to hear refreshing new views of public health and what it means. Because like, as you said, I think it means, and it is in like every facet of our life. And the more you understand public health, the more you understand just how much it is. So yeah, thank you for sharing that.
Of course.
Yeah, so you began your collegiate career at Montclair State University, and you finished with your bachelor's in sociology. What was your thought process going into this? Did you start off as a sociology major? Tell me.
Well, yeah, so I didn't start off a sociology major. When I got accepted to Montclair State University, I got accepted into their bio programs for minorities. And just like, any college student, you're taking your electives, and I took Sociology 101. And that semester, it was a great semester because in that class, I learned about race and the impacts of health. That was the year when Obama was running for president, being the first African-American candidate or president, I should say. And then that was the year, of course, Hillary was running with him and being the first woman to run, against a man. So there were so many different societal issues that was happening around that time. And I felt like I've learned a lot in that class where there was a lot of things that I resonated with, right? We talk about your socioeconomic status. They talked about, the Tuskegee studies, healthcare in America. And I enjoyed the class so much that I started to take more classes in sociology. And I remember my counselor saying, "Are you becoming a sociology major?" Because my bio counselor at the time, and I said, "Oh, I actually love the actual course. So I don't know. Let's see." And eventually, one thing led into another, and I ended up switching my major, and I absolutely loved it because, again, I didn't really know where I was going next, but some of the information that I learned in undergrad prepared me for my master's, because it felt like I didn't get a bachelor's in public health, but some of the information was almost similar in my master's. So it kind of prepared me in a way.
Yeah, I absolutely understand that. Sociology has a lot of intersectionality in it, and just understanding demographics of populations. Mm-hmm. So it's very similarly aligned to public health in a lot of ways. And I think that's a good way to get into public health and just understand what that means in public health, and just what populations and population health. And as you said, you learned a bunch of different new topics. And I also took a sociology class. I want to say probably everybody takes a sociology class, either sociology or psychology, I'm guessing.
Psychology.
Yeah, so that's awesome. And I love I love sociology. So I think that makes a lot of sense. When in your collegiate career did you switch from a bio major to a sociology major?
I actually switched my junior year of college, and I still graduated on time because I was kind of smart about it. I was like, okay, well, if I switch, I have to make sure that I continue to take these bio courses, in which I did, but I had enough credits to graduate. And I think it was the best decision that I made, because I really enjoyed, there was so many different things that was happening in society itself that the professors did a really great job touching on. And it's great information to know, right? Current events and all of the stuff that is happening around us, from the music that we listen to, again, from the healthcare system, access to care, race, living in a certain environment, how one is treated living in one environment versus another. And you talked about population health, taking sociology, statistics, all of those different courses that I take literally prepared me for my master's. And unknowingly, a few years later, I ended up getting my master's. Like, wait, I took this class. It's similar to what I've learned in my bio class. So I feel like it was fate. It worked out for me.
Okay, that's awesome. That's awesome. I'm glad to hear that for you. So after we're gonna get to your MPH, but when did you know about public health? Because you said you're a bio major, then you went into sociology and completed your degree as a sociology major. When did public health come into your mind?
So I remember graduating, and so just to kind of go back a little bit, I should have mentioned this. Well, the purpose of me starting off as a bio major, because I was interested in becoming, first I wanted to be a doctor. Then I was like, all right, this isn't it. Then I said, I did a lot of those college medical tours with my school, and I learned about the physician assistant program. So that's why I continue to take my the science courses. And then I ended up graduating from Montclair State. And when I graduated, looking back at some of their graduate programs, they had, well, not really the graduate programs, but the undergraduate programs, I learned that they had a public health program. I said, well, public health. So I did my research and I said, if I knew about this program, I probably would have taken that instead. That is what I remember saying. So I continued taking the courses that I needed to get into PA school. And I started researching more about public health, and Montclair State had that year started their cohort MPH program. And I decided to change my route. I said, you know what, I'm thinking about to get my master's in public health. And I applied and I got accepted. And that's where it all began for me.
Okay. And getting accepted into your MPH program, did you still have a vision of going on to PA school afterwards? Because I know I have a couple of colleagues that have done the MPH and then have gone on to well, not colleagues, but friends, and then went on or are in PA school right now.
You know what? No, honestly, because when I took my first semester of my in graduate school for my public health degree, I felt like it was my calling, right? Like learning about the different courses, implementing programs, health education, because I've always had an interest in health education. I remember taking a speech class, and I sometimes reflect about this, like I did my speech on how to inform the students about taking care of your teeth, right? And I remember everyone in my dorm, like in that floor, was like, "Oh, I think I'm going to do that," right? Because it's oral health, right? So that love for health education has always been there. And when I started taking all of the courses that I needed to graduate, I realized I think that getting my public health degree was the best decision I made. I felt like that was for me. As far as going back to PA school, that desire wasn't there anymore.
Okay, absolutely fair. So before we go on to your MPH journey, were there any other takeaways that you wanted to share from your undergrad journey?
Any takeaways? I'm just happy that I didn't allow like fear to get in my way of changing my major, because again, I changed it so late in my college career. I could have easily said, you know what, let me just stick this out. I have 1 year to graduate, but I continued on and I did what I had to do. And I'm to this day grateful for the decision that I made, because as I said before, it really prepared me for my MPH program.
Okay, well, we're glad that you went into public health. So you're welcome. So you got your master's of public health at Montclair State University, and you said this was the first cohort of MPHers?
Yes.
Wow, how was that?
I think, was it the first cohort? I think it was I think we were the first or the second. It was good. It was great. I met some incredible people in the programs. I look, some of them I'm following on Instagram, and everybody is just doing amazing work. People are directors and just doing some great work. Got their PhDs. They went on to do some really great stuff. So I could say I enjoyed getting my master's. And of course, you're actually focusing on your field now, right? Like it's not all these different gen ed courses that you're taking. You're actually taking, you're actually studying your actual major, and or you're mastering in this particular field. So I really enjoyed it. I had the opportunity to study abroad and intern, and I studied abroad in Nicaragua, and I was there for about 2 weeks, and it was an amazing experience. I went winter 2014. It was such a great experience. So some of the things that I didn't get to do in undergrad, I had the opportunity to do in my master's program.
That's awesome. And I'll ask you a couple other things about Nicaragua studying abroad in a bit. But I wanted to ask, so you said that you learned about public health, you applied to get into this MPH program, you had an interest in like health education. Did you have any idea of like what you would do after your MPH program going into it, or what was that?
Well, you know what? I didn't at all. I did not know. And I used that time to actually network. the network is very important. I remember my first day in class, I met a young lady, and she is who opened the doors for the first organization. Like, well, one for me to get an intern, but that internship turned into a job and then turned into a couple of more years at the organization, which I mentioned before. But as time went on and I started taking more courses, I felt like I enjoyed the health education part of it, and as well as program planning. And when I graduated, I landed a health education position, and that was it for me right there. I continued on in that role as a health educator, and then some program planning and implementing programs, and I really enjoyed every bit of it.
Okay, that's good. Well, thank you for sharing that. And
Of
before we
course.
get into that job that you just mentioned, that you went, I think it was internship and then went to a job, or like
Mhm.
part-time, or whatever the case might be. Tell me a little bit more about the study abroad experience in Nicaragua.
Yeah, so there was an opportunity to either study abroad in Nicaragua or Cuba, and I was like, you know what? I didn't get to study abroad in undergrad. I'm going to take on this opportunity. I went January 2014. It was a 2 weeks program, and when I went, we had the opportunity to live in the communities, learn about how public health is affecting the country. They educate us about, the different communities. We actually got to live in the village with some of those to see how they live, right? To see how their socioeconomic status is affecting, of course, their public health lifestyle, or, their health and wellness, the way they live. And one, to me, it was, yes, an amazing experience, but it opened my eyes to realize how fortunate we are here in the US. Seeing a country that is, poor and, some people cannot afford to live the way we are living, or have access to care, or because they're living so far, they can't see a doctor, or, those type of things. You really take the time to reflect and you think about living here in the US, the lifestyle that we have. Because one thing I always say is that sometimes I get on my peers and like, you have dental insurance, why not use it? Somebody somewhere else would die to get their, get oral care, right? Use all the insurance that you're paying for it, so use it, right? Not everybody can afford insurance, right? Not everyone has insurance. So when I went on that trip, it was an eye-opening experience for me, and I take nothing for granted here, living here in the US, because even though there are some things that we still struggle with here, we still have so much to be grateful for. So.
Absolutely agree with that. I came back from Trinidad as well as Panama not too long ago, and when we think about like poverty in the US, yes, it's bad, but when you think about poverty in these other less resourced nations,
Of course.
it's like it's really, really bad, and you can see that like they just don't have access to the resources or opportunities that someone in the US might have access to, or just like education and all these different types of things. So I could definitely see why it was an eye-opening experience, why you reflect and you're like, I'm grateful for all the things that I have, and pointing that out to your peers as well, because I do think we do lose sight of that a lot when we're thinking about just life, that oh, this is not fair, or whatever the case might be. But we have so much in this, and we're very privileged to be able to do a lot of the things and have access to a lot of the things that we do.
Yeah, sure.
Yeah. Okay. So you came back from, well, I'm guessing I'm timeline wise, I'm not too sure. You might have gotten the job after you came back from Nicaragua, or whatever the case might be. So the job that you got was a field worker at Partnership for Maternal and Child Health of Northern New Jersey. So you said you got this job from another classmate who put you in contact with the person in the organization.
All right. So why I say network is so important, even to those who are thinking about going into public health. What happened was, on my first day in my public health program, I sat next to a young lady and we were talking, and she told me a little bit about herself. I told her a little bit about myself, because when I went to get my master's, I wasn't working. I wanted to focus on going to school full time and finishing in 2 years. And me and her stayed in contact. We did a lot of our projects together. And I remember, so January of 2014, that was, May of 2014, that year was my last year in my graduate program. And I remember being in Nicaragua and it was like, oh my gosh, the deadline, I have a week away before I submit my deadline, for my deadline for my internship project. It's like, I need to find a place. And I remember my classmate, and instantly when I got home, probably within the next day, I called, and someone at the organization picked up and they scheduled me to come in for an interview. And I got the opportunity to do the internship, my capstone with them from January to May. And it was such an amazing experience. It was a stepping stone for me. It opened that door from the internship to landing a job opportunity with them for 1 year at the organization.
That is awesome. And yeah, it is always great when you get that progression from going intern into a full-time position, and just being able to like learn the organization and take on more responsibility as you like learn more during your degree and all of that stuff. So what kind of stuff did you do as a field worker?
Well, as a field worker, what happened was they had received a grant from Superstorm Sandy. I started off just doing health education about their Healthy Homes program, keeping the home safe from flood, mold, asthma, those type of things. So more on the environmental health side, developing educational materials, developing presentations, and all of that I had to show, creating this, starting this program, educating on the program and whatnot. I started that as the field worker, but then they end up receiving a grant. The grant they were funded in June of 2014. And then they called me back to actually work on the grants. So that worked out very well for me.
Okay, that is awesome, and I'm glad that it fell in place like that for you. So before we talk about more of the shift from like internship into full-time position after you graduated, were there any other takeaways that you wanted to share from your MPH program?
Yeah, I just, network, because the network is what got me where I needed to be, right? You often hear a lot of times people come out of school and, they're struggling to find a job. And we live in a time now, it's more than just putting in an application. It's really about networking and who you know. I've gotten all my jobs because of who I know, or just putting myself out there. Majority of my jobs, I won't say all of them, but I just took the time in my MPH program because I saw what happened in undergrad. When I came out, it took me 2 years before I went back out and got my degree. So around that time, we were still in that recession, or coming out of the recession, and it was very, very hard as coming out with my undergrad, not being able to find a job, especially with a degree in sociology. So I remembered all of the valuable advice that I got, and I made sure and I networked. And me networking gave me the opportunity to intern, and the internship turned into a job.
Okay, awesome. And I think that's great advice. And I think a lot of people in the MPH program, undergrad students as well, get carried away with like just doing the schoolwork and focusing on the exams and not doing those other things that are just as important, potentially, like networking with the right people and just getting in, having the right conversations with the right people. You definitely found the benefit in that in your degree as you've shared. So you said as an intern, they asked you to write the grant or help with writing the grant, and then I'm guessing the grant was accepted, and then they brought you on to a full-time position. Tell me a little bit more about that process.
Yes, I didn't write the grant. The grant was offered to them 2 years prior to me coming on, but then by the time I got onto the project, it was only 1 year. So the grant was a 1 year grant. It was bittersweet. It was great because I was able to meet some incredible people at the organization, but also do some amazing work. And I remember saying, oh my God, this is environmental health. I remember taking environmental health in my MPH, and I really didn't enjoy it, but I absolutely love that position. I really, really did love the position, and just educating people about the importance of a healthy home. You know, we just had a flood back in September, you know, and we saw what that, you know, did to some of the communities at Elizabeth. My building, half of the portion of the building was destroyed. So just having that knowledge and remembering what Superstorm Sandy did back in 2014 or 2013, I should say, I was able to take on what I've learned and apply it to my daily life, and, you know, educate others about it. But yeah, it was a 1-year grant-funded program where we just did a lot of health educations. I went to a lot of health fairs, educating the community about lead, asbestos, asthma, you know, the 7 principles of a healthy home. And when when the program was done, I was out of a job, and I will talk a little bit more about that as we move into like my next step and what happened with that. But that kind of sums up what I did for that particular program.
Okay. And just so people are clear, your role at Partnership for Maternal and Child Health of Northern New Jersey was a program specialist that you were in that position. And you said you were in that position for a year, right?
A year. Mm-hmm.
Okay. And then after this grant ended, you moved on to become an organizational development coordinator at St. Barnabas. So tell me about that process.
Yes. So once again, I had a friend from my MPH program that was working there as a community health worker, and I reached out to her because once the grant ended in June of 2015, I was out of a job. So I started to think about, okay, well, let me think about all the people I networked with in undergrad, in my master's program. And I had great connections with, and I did presentations with, and you know, take part in all of the, our projects together. And I kept their contacts and remained good friends. And I had reached out to one of my classmates, and she was working at St. Barnabas. And I said, hey, I just lost my job. Is there an opportunity in your department? And she said, send me your resume. And I landed that position. So again, network is extremely important. And I landed that position. It wasn't public health, it was in the health administration side. And so in that position, I actually worked with the director of organizational development. And the focus in that position was customer satisfaction, making sure the hospital runs smoothly and making sure that the patients, they're treated well, and they have access to everything that they need, and good quality at the hospital. And we work very close to the quality department. So I did a lot of the data. I did a lot of helping with their conference, coordinating all of the trainings and workshops for the high-end leaders on topics that wasn't really public health related, but there was a lot of health administration. But what I would say that the opportunity that I got, or like I said, I took away from that job, is the skills with planning, program planning, putting on trainings, hosting workshops. And because I had those good skill sets, opened the next door for the next position.
And that makes a lot of sense. And I think, like, I tell a lot of people, especially students, that focus more so on the skill sets than anything, because as we know, it's transferable. And as you just stated, you went from this maternal and child health organization into a health system, and you're still able to do the work and do good work because you had those skill sets. And I was going to ask you, well, I'm going to ask you actually, was it difficult transitioning with your MPH degree, going into a health administrative background? I know a lot of people during the MPHs do internships at health systems and things like that. You did not do that. So I just wanted to ask if it was a hard transition for you.
It wasn't a hard transition. I will say the language was different. That the health administration, the language was different. Some of the stuff was like a lot of medical terminology, even for some of the presentations that, a lot of the high-end leaders, you're talking about the presidents of the hospital presenting on, and the language is a little bit different. And that took a little time for me to kind of grasp. But when it came to putting program planning and putting together the events, the skills for that was already there. Because that's something that I enjoy doing. So it was easy to do that. And I did a lot of the event planning and whatnot. But when, again, health administration is a little bit different from the world of public health. I mean, people do get a concentration in that when they're getting their MPH, depending on who offers it. But I didn't have that background. But I made the best of it.
Yeah, making the best of it is all that we can ask for. But I think it's key that you mentioned that like language is important, because as you move into any space in public health, they're going to have specific languages. If you move from one state to another state, or just one organization to another organization, different language, different acronyms. there's just a whole bunch of different leanings that is in there. But like as you said, you still had a lot of the skill sets and were able to do a lot of the work. It's just learning how to speak health systems or health administration. And I think that's something that we can all pick up, but having the skill sets is something that's more important in the end. And as you said, networking was a key for you getting this position and being it. So that's dope to hear as well.
Yeah, absolutely.
So then after this position, you went on to become an adolescent immunization specialist at Partnership for Maternal and Child Health of Northern New Jersey. So what was the thought process for this?
Yeah, as I mentioned before, I was at St. Barnabas for a little while, and then I saw this position and I was like, all right, I'm still fresh out of my MPH program and I want to get back into the public health world. And I ended up applying for the job, and because I had a relationship, I worked with the organization already, that kind of helped, that will actually helped a little bit. But I got the job, and I was there for about 5 years, and I did some really great work with a great team of people, and my focus was on the importance of HPV and the vaccine, educating parents about the vaccine. And I remember back in 2016, HPV was just a hot topic. So, educating health professionals on how to discuss this vaccine with the parents, because, there's this big pushback with HPV and either the vaccine, right? So just increasing the awareness and educating the community and parents and health professionals, why this vaccine is important. And so I did that for about 5 years. There was also that technical assistance part. I had the opportunity to did a lot of program planning, and we implemented this program from the bottom up. So I actually saw this program go from nothing to something. And that was a great experience for me, because that's, again, my another set of skill sets for that. Like, I've never implemented a program from scratch. So all of the materials started with me and the director that I work with. So super grateful for that position as well.
Yeah, and that sounds like it was a great way to learn and incorporate everything that you had learned up to then to really build out a program. And I think like just being able to do that, or say that you do or have that experience, is helpful in like interviews, and just like knowing how to speak to it is highly important. And I just realized that this is the same organization that you interned with and then you got hired into after you graduated your MPH program. Was it weird to go back there afterwards, or what was that like for you?
No, definitely not weird at all. I was actually sad when the program ended the first time. A really great organization to work for. My direct reports were really great. And it was kind of like a teaser for me. The first time was like, I got a little piece of what it means to work in the field of public health, and then it just went away because the grant ended. And that's what it is, right? And when you have grants, you're working in an organization that there was grants, right? You never know, but it's okay, right? Because I had the opportunity to go back, and I was extremely happy about that, because I know I was working for a great organization.
Okay, that's great to hear. How big is this organization? Just for my
it's pretty big. It's an organization that focuses on children, women, and family. There's a variety of different programs. So I worked under the immunization programs, but there are other umbrellas, right? There's on postpartum depression, substance abuse, the lead poisoning program. So it's a pretty big nonprofit organization. Think about 100+ people.
Okay. Well, thank you for that. And
Sure.
yeah, that's definitely important information that you do in the health education around, especially HPV vaccines and the importance of that. We know how important vaccines are just in general, but there's definitely a lot
Absolutely.
of misinformation and misunderstanding, I think, around HPV. I think that's still the case to this day.
Of course.
Yeah, and interestingly, but okay, so you were there for 5 years as well.
Mm-hmm.
Was
I
there
was there for 5 years.
was there any progression of like the roles that you did or different things that you took on during that time?
Yeah, so in the beginning, I will say it was a little challenging just trying to start this program from the bottom up. But then I learned a lot because there was a lot of pulling reports, technical assistance, showing, talking to healthcare professionals from 8 northern counties of New Jersey, showing them like, here, this is where your rates are, this is how you can improve, then educating them on how to talk to parents about getting this vaccine, right? Going from that to, presenting and doing a lot of virtual presentations, and then getting the opportunity to present my work at a breakout session at Rutgers at their immunization conference, having the opportunity to go to the CDC conference and to learn more about the HPV on their HPV track. So there was definitely a great learning experience over the course of the 5 years.
Okay, and that's good. That's good to hear. I'm glad that you were able to get those experiences and learn throughout those 5 years that you were there. There was something I was going to ask you, but it's just completely forgot. So we'll move on. So you currently work in this position as a program coordinator at Rutgers University Center for Public Health Workforce Development. So how do you come across this role?
Well, man, like, listen, this was an interesting. Just getting this opportunity was a great or interesting situation for me, I should say. Well, as I mentioned to you before, so prior to getting this role, I had got asked to present the immunization conference for a breakout session, and that was on my resume, and just having that experience was a great experience, right? Because the Rutgers, they put on this conference every year, and I knew it was time for me to kind of move on in my public health career. After being at the organization for 5 years, I was like, all right, it's time. It's time to kind of take this my public health career to the next level. Started thinking about what is it that I want to do, what is it that I enjoy the most, and I think that is extremely important when you're looking for a job, especially in public health. As I mentioned to you in the beginning, public health is very broad. And I really enjoy hosting webinars, putting on trainings, planning conferences, planning health fairs. I enjoy the event planning, the logistics part of my job. And I came across this position in June of 2021, and I applied. But I've applied to a couple of jobs, but sometimes you apply for a job and you forget. And I got an email back. Was from my current boss right now, and she asked me to come in, asked me if I wanted to be interviewed, and of course I got interviewed, and when I look at the position, it was like everything that I wanted and more, and it was like one big full circle. She was literally the person that reached out to me 4 years ago to be on the immunization track. Now I'm actually helping them plan the immunization conference. I actually went to the public health symposium 4 years ago. Now I'm actually planning with them the immunization, the public health symposium for Public Health Week. So it was one big full circle, but I didn't realize that until after I got the job. So for me, it was really about growth. It felt like 5 years. I think I learned enough, especially in the role of immunization and learning about HPV, but I really wanted to further my career, but do something that I was great at. And not to say I wasn't great with the other work that I was doing. I just enjoyed event planning and program planning and all of that. So that's where I landed with Rutgers, and I'm so super grateful for the position. I love the team that I work with and the departments. Amazing people.
So I'm gonna ask you a couple more questions about the job, but like you said that it was 5 years on that last job and you were ready to move on and you really wanted to move into a role. Sorry, you really wanted to move into a role that you love, or like you love the different roles that you do within that role. So what advice would you give to someone that's looking for a job and they don't know like where they fit, what they love and things like that? What advice would you give to someone that's looking for like that kind of fit in their role or in their job, I should say?
You know what? It really depends, right? Because if you're now coming out as a public health, like you're coming out of grad school, right? Like when I came out of grad school, I really didn't know where I was going next. What I did know is I wanted a job in public health, right? But you know, I was still trying to figure it out, but I definitely enjoyed the health education part of it. I will say this, take some time to really reflect and see what is it that you enjoy, because if you know that you struggle with public speaking, that is something that I struggled with in the beginning. Until this day, right? Not public speaking is not for everyone. It could be very nerve-wracking, right? Like standing in front of people presenting, but find something that you really enjoy. Like if you know you love program planning, or you know you love epidemiology, or you love stats, find a job that resonates with you. You know, you're not always gonna get the job that you want, but you have to start somewhere, right? And you build on that. And one of the things that I've done is try to build on my skills. A lot of personal development, you know, I talked about like presentations and whatnot, and presenting, you know, maybe, you know, learning, you know, finding different ways to present and all of those different things. So anyone that's coming out and they're looking for a job opportunity, or you're already in the field, but you just can't figure out what is it that you love, take some time to reflect and write out what is it that you like to do. Just think, put work aside, but what is it that you enjoy doing? And for me, event planning was something that I've always enjoyed doing, program planning, coordinating programs. And I somehow always landed roles in that area.
Yeah, and that makes a lot of sense. I think that everyone should take some time to reflect and see what they love, what they love to do, and see how they can try to find the job or the role that allows them to do a lot of that work that they were saying. And you were saying that it was full circle for you in this position, because you got to attend a lot of the events, and now you're the person that's like coordinating and hosting the events, the symposium that you said, and I think another conference. What advice do you give the people who want to like do events, or like what's something that people miss a lot about like having a successful event?
I think it's the logistics, you know, planning out the event. Hopefully I'm answering this, you know, the best to my knowledge, but like, if this is what you're asking for, when planning an event, you have to really figure out, you know, how big of an event you want. This is going to be, well, right now it's a virtual world we're living in, right? We can't have anything. I mean, we can, but it's risky, right? You know, how many people do you want at this event? The kind of speakers that you want, your theme, you know, really definitely taking the time out to outline and plan, because there's a lot of logistics that comes behind planning. And it's, you know, it can be stressful too, but because I enjoyed so much, that part doesn't really bother me. There's a passion there for that. And I love the part where I can, you know, reach out to potential speakers. I love to create the outlines, the time, manage the, you know, the management part of it. So it's really creating an outline and creating that vision of how you would like to see it. Now, again, in this position, it's just not me doing it by myself. There's an actual team, right? So you have people with different ideas, and you have some people who've been doing this way longer than I have, and you learn from them as well, right? So for me, it's just taking what I've already know, but also learning from the people who are experts and applying and doing my portion to the best of my ability. But it's the outline for me. It's the planning. I'm very punctual when it comes to the whole event planning part of it, especially with speakers, just being on top of everything and being organized, so hopefully that answers your question.
Yeah, it absolutely did. And I think just the insights of you saying that, like, you like a lot of this, you know a lot of it, but still, as you're doing this, you're learning from the other people that have a lot more experience doing it, and seeing how you can integrate what they how they operate their events, or like how they think about it, into your learning. And I think that's how we should all try to be in our learning and our experiences as we grow as professionals. So I appreciate
Absolutely.
you sharing that. Yeah. And you are certified in corporate wellness. You're a certified corporate wellness specialist. So tell me, what was the thought process behind getting this? When did you get this degree, first of all, and then what was the thought process behind getting the certification?
Yes. So I learned about the certified corporate wellness specialist certificate back in 2018, and it was October 2018, and it was like, oh man, like, I don't really have the time right now to even look into getting a certification, because I had so much going on with work, and just my schedule was busy. But I said this would also be a good time to kind of, to dig more into what it is, because I had an idea, but also thinking about like my long-term career, like what is it that I see myself doing, and why. And you asked this question in the beginning, how are you coping during this time? And I said to you, just, finding ways to manage stress and self-care and all of that. And I feel like as public health professionals, we are the people, our work is not like the healthcare frontliners, but we are also putting in a lot of work, right? I'm pretty sure within this 2 years, those who never heard of public health understand what public health means. And we do a lot of work, whether it may be doing work in the community, whether it may be doing work in a hospital, being the person on the behind the scenes, the epidemiologists, the just different types of work, right? Mm-hmm. And but sometimes there's that portion, and just with anyone working, we neglect ourselves. And I've gained a passion even over the years of the importance of workplace wellness, because yes, we're working, but how are we taking care of our physical and mental health, right? How are you going to perform well if you are not mentally together? How are you going to perform well if you're not physically together? And in the workplace, sometimes there's how can I say, increase of people leaving or retention because of burnout, because people are extremely stressed out with their work, because people are putting work before taking care of themselves. And, I've had my share fear where I've neglected my self-care. And I just one day realized that in order for me to perform my best at my job, I have to make sure that I take care of me to do very well at my work. And so that is where I started to do some research, and I learned about the corporate wellness certification. And literally, when the pandemic hit, I had so much time on my hand. There was an opportunity right then and there to get this certification. And I got it in June of 2020. And I feel like that was one of the best decisions that I made, because even though corporate wellness, even though it wasn't something that I've learned in my public health, when I was getting my master's, it is still a part of public health, right? It's managing, creating health and wellness programs at corporations, right? They're talking about managing stress, chronic disease prevention programs. So all of these things, like I said earlier, there's public health in everywhere and everything, and a lot of us don't realize that. So my passion really is to long term to be able to put on or host, to continue to host health and wellness events for like employees.
Okay, well, thank you for sharing why you got into that, when you got it. I see another blessing of the pandemic. You got some time to be able to get the certification, which is something that aligns with like your broader vision of what you're doing and things like that. What kind of things do you go over in these corporate wellness specialist programs, events? What kind of things do you talk about?
Yeah, so you could talk with, I've been asked to do presentations. I mean, it's on a variety of everything. I had a friend a couple of years ago, twice, I'll give you an example with that. She worked for a pharma company, and their organization was on big on breast cancer awareness, right? And she had me come out a couple of times and provide education on the importance of breast cancer prevention. Stress management, managing stress, and work-life balance is another one. How do you identify stress? How do you know when you are stressed out? What can you do when you're stressed, right? And especially during this time where people are working remotely, we're glued to our computers, right? We don't know how to take a break. Well, we do know that when we're working in the office, sometimes you may get up and you walk to your coworker's cubicle and talk to them for a little bit, right? Or you may say, oh, let's just take a walk for some fresh air. But for some reason, while we were home, a lot of people weren't doing that. They said that they shut off their computer at 4 o'clock or 5 o'clock. They were working at 9, 10 o'clock at night. And so these are some of the things that I kind of talk about. Mental health, right? If you know that you feel depressed or there's some anxiety there, to learn how to speak to someone. Don't be afraid to talk to your boss or a colleague about how you feel, and creating a space for people to be able to speak up about that. Because folks are not mind readers, so people would not know what is going on with you if you don't speak up.
Yeah, and I think that's important, especially during the pandemic. It has been very tough for a lot of people to disconnect or to create those boundaries between work life and personal life, especially if you're working from home and you just have access to your computer and you just continue to do work. But as you said, I think it's also important to understand to do the best work that you can do. You have to have a full cup. You have to be able to take time for yourself and get your wellness as well as it could be in order to be impactful and do the job to the best of your abilities.
Absolutely.
Yeah. So okay. Well, I'm glad you got into that, and thanks for sharing some more about that. And then now on Instagram, you created this profile where follow Kendra on Instagram at health&wellness_guru. So tell me about the thought process for you starting this Instagram page.
Yeah, when I started this Instagram page, it was probably like 3 years ago. It was just a place to just put some health and wellness information. I wanted to be just a broad health and wellness page. It doesn't have to be so focused on just public health issues, but getting up to walk, right, when you're during a work day, why it's important to walk, or information that is happening health related in the media, something I may post there, and just a variety of different things. I've posted events that I have hosted in the past. I've posted some podcasts with some incredible public health professionals that I've had the opportunity to interview, like yourself. So just a page for me to just post a variety of different work that I'm doing, the organizations that I presented for, and whatnot. So I remember being so nervous to start this page 3 years ago. I'm like, what am I going to post? But through time, I found a way to post different content. And so I'm extremely happy about that, because I've had people share some of my posts, some of my events, the flyers that I've, for events that I was getting ready to host. And I've had lives on there last year while I was working from home full time. And again, so just talking to other public health professionals to see what they have going on. And the kind of feedback that I received, you just don't know how you're impacting someone. And I've got a lot of great feedback in my inbox. So I'm super grateful to have this page.
Yeah, and I'm grateful because that's how we connected, and I,
Yes,
how I got you onto this show today, just because building those networks, and I think like just being present on social media, whether that is Instagram or whether that's just like LinkedIn, I think it's just important for us as young professionals, especially as the field gets more competitive. Like,
absolutely.
and as you speak into like just networking and just building relationships with people, is going to be just as important as the work that you're doing. So I definitely understand that. And yeah, it could be very hard to have an Instagram page and
Yeah,
feel a lot of pressure on it, but
yeah,
as you said, I think like once we understand that this could help someone, it has a potential to help someone, and it's evergreen,
absolutely.
it's going to be there for a while. I think that's some important stuff there. So definitely go follow Kendra if you all are interested, everyone. um
Thank you.
yeah, you're most welcome. And then before moving on to the Furious Five, I wanted to ask you, where do you see yourself in the future?
I see myself in the future just doing some amazing public health work. If somebody would have told me 7 years ago or 8 years ago that I would be working at Rutgers doing some great work with an amazing group of people, I would have been like, oh, you guys are joking. But it took hard work to get there. It, I just continue to work hard and just continue to take all the amazing advice along the way and kind of build on my skills. And there's an opportunity to learn, like register for a webinar. If it's outside of work, I'll do it. So in 5 years, I know that I love program planning and event planning. I really hope to continue to do that work, focusing on health and wellness, not just focusing on one health issue, but just a variety, and just creating awareness, because I've seen the importance of putting on health education events, how they have impacted people tremendously, right? You talked about misinformation and people using Google as a source to get all of their information. But when you have a public health professional who's passionate about their work, I'm pretty sure you could say the same for yourself, and you could educate people about the importance of taking care of themselves and just creating awareness. To me, that's big. And so I just hope in 5 years I'm doing more of that. Like, I feel like I'm doing a lot of it now, but just seeing the greater me.
Yeah.
Older though.
And I like that. I like that you kept it pretty broad, and just focusing on like those skill sets and yeah, skill sets, tools that you have in your toolbox that you want to like work on more, or just be more focused on those types of things. So thank you for sharing there. And as you were saying that, actually, I was thinking, before I move you on to the Furious Five, what does the Rutgers University Center for Public Health Workforce Development, what does that Center for Public Health Workforce Development, tell me a little bit more about that?
Yeah, they're focused on so we have the side where they focus on a lot of environmental health and work you know workforce development, health and safety. You have that part of the department, but then you have the department where I work, where I put on a lot of health and wellness governmental health and wellness webinars, for monthly webinars for governmental employees. And we've put on a couple of so far. I started in September, and we did one in October for what to do in the aftermath of a flood. We had one on COVID-19 vaccines and booster doses. I just hosted one this week on the opioid crisis with a focus on fentanyl. So this is basically information that, where I'm able to reach out to a speaker, thinking of the topics that some of these professionals are asking for, what do they feel is a need for? And they take this information and how they could share it to those, in their community and those they're working with and whatnot. And we plan, like I said before, we plan the immunization conference that's coming up in May. I'm also on the planning team for the public health symposium, which is Public Health Week. So, and this year's focus for both events would be on effective communication, because there's a lot of trust, you kind of, the story behind it. So effective communication would be the focus for the symposium, and misinformation would be that theme for the conference. So I'm super excited about that.
Yeah, that is super exciting. And those are definitely two huge topics that we've seen a lot of around during this pandemic time. So we appreciate you all taking time and making space to talk more about those topics.
For sure. Thank you.
You're welcome. And then moving on to the Furious Five, the last section of the show, the 5 questions that I ask all guests. Number 1, what advice would you give to a student trying to pursue a career in public health?
Yeah, take some time to, do your research. I mean, there's some pretty great programs out there, schools that are offering some different concentrations. So whether, I know your undergrad, it's just kind of one focus, but I know for sure, I always tell those who are going in to get their master's, find a focus that works for you. And a program that has a variety of different focuses, because health education may not be your thing, but epidemiology maybe, right? Or, health administration with a focus on health administration maybe. So just taking some time to do research, network, ask questions, especially those who are already in the field, and they could kind of give you some guidance.
Yeah, great advice. Number 2, if you were talking to someone wanting to get into your position, what advice would you give them?
Be patient. Be patient, because it wasn't easy. Be patient, take some time to, work on your skills, right? Because just your skills is what's going to get you to where you want to be, right? Like the skills are always transferable. So, again, you saw how I went from public health to health administration back into like doing work in my field, public health. So, and just build on those skill sets, again, talk to the experts, the people who are already doing the work, ask for help. I think that's one thing. Sometimes we're too prideful to ask for help because we feel like we're already there, and it's nothing wrong with that. I already have my MPH and have a couple of years on me, but that doesn't mean I'm not going to ask for help, because there's so much that I could learn. So never be afraid to ask for help.
Yeah, a lot of value is being gained from asking for help. So,
of course.
Yeah, thank you for sharing that. And number 3, what's something you are working on improving in your life right now?
What am I improving on in my life right now? That's a really good question. It's pretty broad. Going back to what I said before, there's a lot of professional development out there that I don't plan on getting my doctorates. People often ask that question, but I do plan on getting some certificates. Right now I'm working on getting my CHES certs. But if it's anything, it's really adding on to what I already have, and again, building on my skill sets so I could be a better leader or continue to succeed in my career. So there's always room for that improvement. Can I think of something right now? Probably not. But as a public health professional, just continue to move up that ladder and improve on myself to be the best leader that I could be,
I like that a lot. Number 4, professionally, do you recommend anything?
Professionally?
Do you recommend anything?
One, your podcast. Listen to your, really, you have really great content, especially for those looking into becoming a public health professional, those who are in their field already, listening to your and all of the public health experts that are out there. Self-help books is good too. I often read a lot of self-help books, because at the end of the day, even though, I'm still moving to where I want to be, I think going back to your previous question, there's things that we still need to work on, right? A lot of people often talk about having that imposter syndrome, right? And sometimes I read certain books or listen to certain podcasts that kind of give me that push. So, listening to different podcasts that resonates with that, with you. And if it's in fact that there's a focus on your career and it is public health, I think listening to some of the public health experts, again, you have a lot of great content, and just reading some self-help books is good too.
Yeah. Thank you for sharing that. Are there any specific self-help books or like one that comes to mind, as well as a podcast, or
no? The one everybody read this book, You're a Badass. I love that book. It's just, I started reading it again. I bought that book 3 years ago, and I picked it up and I started reading it again. And it just basically talk about removing your fears and going after the things that you want in life, no matter what it is, right? We are human beings. We often fear a lot for whatever reason, but the things that we create in our mind isn't real, right? It's just really overcoming the fears. Everything you want, you often hear it, is on the other side of fear. So we just have to keep pushing. And that book is an example of that. And she kind of talks about her life and how she got to where she is today. And I think about myself, who I was 6 years ago is not who I am now. I would have never been on a podcast 6 years ago. Never. And I probably would have, if I did end up on a podcast, I would have told you, please take the camera off. So, that's one of my favorite books.
Okay, awesome. I used to have there's a calendar thing that is for that book that I used to have on my desk. I don't know if I threw it away, but it's not here. But I know I bought my sister that book a couple of years back. I have not read it myself though. Okay.
Yeah,
I'll add it to my never-ending book list. Thank you.
Yes, it's a really, really good book. I mean, it's not public health related, but it's self-help, and it's a really, really good book that someone recommended, and I was like, I'll read it, and I ended up reading it 3 years ago, and I picked it up again and I read it again, and it's really good. So
that was awesome. That definitely means it's a good book.
For sure.
And then number 5, last and not least, where can people connect with you?
For sure, you can definitely connect with me on my Instagram page, Health and Wellness _guru. And we could definitely connect there, and you can find a lot of my content there. And I plan on posting a lot more this year. So I hope to connect with some new folks.
Yeah. And everybody hold her accountable if she's not posting more this year.
Yes, please do.
Awesome. Well, I'll be sure to link all of those things in the show notes for anyone that is interested. But thank you so much for taking time to come on the show. Really appreciate you sharing your story and your insights.
Thank you so much, Amari. This was great. For the longest that I had to reach out to you, and I'm so happy that I had the take part in your podcast.
Yeah, my pleasure. Always glad to have a Trini on air. Glad to have a Trini's in public health. So we love it.
Thank you.
You're most welcome. So housekeeping items, everyone. Thank you so much for watching. Be sure to subscribe if you have not subscribed as yet. Leave a like, leave a review, share it with a friend. That greatly helps the show get out to more people. If you'd like to support, outside of just subscribing and reviewing, you can go to thephmillennial.com/support or buymeacoffee.com/support, or you could go to thepublichealthstore.com and check out some public health apparel and use the code thephmillennial to get 10% off. So yeah, everyone, enjoy yourself and have a good week.